Doctor, my eyes have seen the years.
Welcome back to Accent Your Beauty. I'm Jackie Kallen, and I'm here to bring you the best, actually I'd say it's the #1 cosmetic surgery show on the internet today. And you can find us every week on New Radio Media. Dr. Berkowitz, you brought us a guest tonight.
I did.
Tell us who you brought.
I am so excited to introduce Dr. Jay Novetsky. He is an outstanding ophthalmologist with a history of performing refractive surgery. And for people who don't know what refractive surgery is, it's the procedure in order to help get rid of glasses or eliminate glasses. And he will talk a little bit about the procedure. But what I love about it, being his partner for over 23 years, is that his patients see so well afterwards that they start noticing some of the lines are on their face
and
realize
teamwork. It's teamwork here.
realize how they're aging, and then come to me for some of the cosmetic work from there.
Well, that's a good deal right there. Actually, I think we can see our lines just fine. Women especially, no matter if we're half blind, we'll find every extra little line. So
it's that magnifying mirror.
We end up, of course, we all have magnifying mirrors. We end up coming to you anyways. But explain what refractory surgery is for someone who doesn't know that word.
So refractive surgery is a surgery whose goal is to get people to see really well without glasses. That's in a nutshell what it is.
And does it work for all different types of astigmatisms, nearsighted, farsighted? Because there's various problems that people have.
Right. So in general, the way you look at it is if your distance vision is blurry without glasses, in general, we can fix it with one form of refractive surgery or another. There's another problem with vision, which is very common in folks older than 40. And that may have good distance vision, but they start finding that their arms are too short, they can't see up close.
It starts with looking at business cards. Someone hands you a business card and you're looking at it, and all of a sudden, that's how
now
I
it's
first
cell
noticed
phones. You
it.
keep making the
Right,
print
you have
bigger
to keep
and bigger.
thank goodness with cell phones you can make the font bigger, but you can't always do that. So there is a solution to that.
Right. So that problem is called presbyopia. That's not the same as astigmatism or nearsightedness or farsightedness. That's a unique problem where the lens within the eye no longer can accommodate, can focus at different distances. That problem we've attempted in the past surgical fixes for that, but really we don't have an effective fix for that problem of presbyopia other than a really much larger operation, which is called refractive lens exchange, which is like a cataract operation. Many of our cataract operation patients see very well, both distance and near, without glasses.
So would you say cataract surgery is refractive surgery?
Well, I've been practicing what we call refractive cataract surgery for more than 25 years. And that is when I operate on someone that has a cataract. Now, a cataract is a cloudy lens. Patients come to us with cataracts that could have very thick glasses, thin glasses, or no glasses at all. My goal is to give them better quality of vision, but also a very important job is to get them to see well without glasses. So in fact, cataract surgery is the most commonly performed refractive surgery in this country.
Well, is cataract surgery, when you mentioned it's a foggy, kind of a cloudy lens, but isn't it actually like a little film, a little layer of film that you can peel off? Surgically, you can remove that?
I wish it was, but it's not.
So it's an actual lens?
Yes, if we think of the eye as like a camera has a lens and has film or electronic film. So the lens of the camera or the eye, that becomes cloudy, and that can be at any age. It's not just for seniors. We operate every week on patients that have cataracts that are in their 30s. It's not common. It's much more common in people 60 or older, but it's all ages. So it is removing the natural lens, which we do through a 2-millimeter incision, a very less than 1/8 of an inch incision. We remove the cataract, and through that same 2-millimeter incision, we give them a new lens that we place inside the eye. So in a sense, we take their eyeglass prescription, miniaturize it, and put it back in the eye. And after surgery, after healing, within a few days, patients in general can see very well without glasses after cataract surgery.
And it's not that painful, is it? Because I see people that have it done all the time, and they seem to bounce right back.
Well, it's not painful at all. You don't have to go to a hospital. We have our own ambulatory surgery center in our office on the second floor. Patients come in, receive a little bit of relaxing medicine, like a Valium kind of relaxing medicine. They get some eye drops to numb their eye. They're completely awake during the operation, and they feel no pain at all, neither during the operation or after the operation. So it's a very delicate, important operation, but it doesn't require prolonged rehabilitation. Patients can go up, have their same active lifestyle the same day as surgery. They can bend and lift, play golf the next day, and really it's really a miracle what we can now do with cataracts.
What causes cataracts?
Well, the most common cause of cataracts is we don't know.
Okay,
But
so there's no real reason.
It's associated with aging, but like I said, there are patients that are not elderly at all that have cataracts. There are certain drugs, certain x-rays that can cause this, certain side effects of medications that can cause cataracts, but the most common cause is just folks that are in their senior years.
Why is it that your far vision, you can retain that longer than you can the close-up vision? Is there a certain part of the eye that tends to go first?
Well, I wore glasses when I was 11 years old. My distance vision has always been blurry. I'm wearing contact lenses right now so to correct my distance vision. But the change in the flexibility of the lens changes its shape, and that changes its focusability. So if you correct the distance vision problem, even having done that, you still can't fix the flexibility issue, which occurs at some point in the late 30s, early 40s. People that never wore glasses their whole life, by the time they reach their late 30s, early 40s, find that they're having difficulty reading their cell phone or holding a paperback or a Kindle to read it clearly. So that's the most common form of refractive surgery nowadays.
Which it is not to be confused with cosmetic surgery, because it's not a cosmetic surgical procedure, correct?
Well, we talked about this earlier. Is refractive surgery considered cosmetic surgery? So I would concede that to the extent that someone looks better without glasses, then you've performed a form of cosmetic surgery. But the surgery itself, I would not call cosmetic, because the sort of the phrase that I always use to tell my patients is cosmetic surgery changes the way that we look. Refractive surgery changes the way that we see. So it's really the opposite.
That's a good way to explain it, because that makes sense.
And some people, they put on glasses because they like it as an accessory to make them look better, so then that part's cosmetic for them. So it can go either way, I think, as far as doing a procedure like refractive surgery to diminish your need for glasses, while others will put on glasses even with what's called a plano, no prescription in it, because they feel they look better with it.
I have a friend that does that. She just likes how she looks in glasses.
Well, that's actually much more common than I thought. I operate, once a week. We do many cataract surgeries, but before the surgery, I ask the patients, is it important to you whether you wear glasses or not after the operation, from their standpoint? Now, before I started asking that question, I assumed that, of course, who would want to wear glasses? What a stupid question to ask the patients. But what I learned from experience, it's not a stupid question. And in fact, there are many people that will say, doctor, I don't care if I need to wear glasses. I'm not interested in that. Or even more than that, more commonly women than men, that will say to me, oh, no, I really want to wear glasses after the operation. So,
well, sometimes glasses are a fashion statement because there's so many beautiful ones available, and they're so stylish that sometimes you just like the way it looks, makes you look more studious, more serious. So I understand when I was growing up, and maybe when you guys were growing up too, kids that wore glasses were teased and bullied and called four eyes and all kinds of things. Now, I have a granddaughter, 9, that has plain glasses with no prescription because she kind of likes how it looks.
Probably one of her friends got glasses, and she said,
Probably
"I want the
so.
same."
I want the same thing.
So-
But it's still, I think, a viable option so
So-
that you have that choice.
So what I explain to patients is that whether you want to wear glasses or not after the operation, the goal of our operation is to reduce your dependency on glasses. People really have to wear glasses in an emergency. What happens if you have to exit a building and you don't have your glasses? So, or just on a day-to-day basis, walking around the house, how dependent are you on the glasses? And that's really a functional issue for everyone. So whether you choose to wear glasses or not, we always try to reduce one's dependency on their glasses.
What about dependency on contact lens? When you have the surgery, do you no longer need to wear contacts?
Well, it would be the same as glasses. So
So-
if you can wear contacts comfortably before the operation, in general, you can continue wearing the contacts if you need to after the operation. But that's actually not that common. It's rare for patients to want to wear or need to wear contact lenses after any refractive surgery because that's the goal, to get them
Well, you
out of
mentioned
that.
that you wear contacts, correct?
Right.
So have you not had the surgery?
No, I haven't had refractive surgery, so I wear contact lenses. I'm not a candidate for the refractive surgery because my particular prescription is not treated very effectively by the refractive surgery lasers.
Well, let's talk about that for a minute. How do you decide who is a candidate for this surgery and who is out of that circle of being, a good candidate?
Okay, so laser vision correction is the most common form of refractive surgery where we're treating nearsightedness. Now, nearsightedness is a term that's really confusing, but what it really means is that I can see up close, I am nearsighted, but the opposite is also true. That means your distance vision is blurry. So we now have a very effective way of treating distance blurry vision with the laser. And there are different types of surgeries to use with the laser. The two most common procedures are LASIK and photorefractive keratotomy, or PRK. So LASIK or PRK are the two most common forms where we can get people to see very well without glasses. But in order to do that surgery, they must undergo a very careful screening process by an eye specialist, either an optometrist or an ophthalmologist. The optometrist or the ophthalmologist will do a very careful measurement of their nearsightedness, will measure the curvature of their cornea, because that's how the operation works. The laser reshapes the outer covering of the eye, the clear cornea as it's called. We never enter the eye. We were talking before about a cataract, which is inside the eye, but with laser vision correction, we're never entering the eye,
So you're always on the surface.
only on the surface, reshaping the outer surface of the eye. So the limiting factor of that operation is the degree of nearsightedness. So when you go to your eye doctor, they'll tell you with a number how nearsighted. So in general, LASIK or PRK is effective for about 8 diopters, or 8 units of nearsightedness, and about 4 diopters, 4 units of astigmatism. Astigmatism is a condition where the curvature in one direction on the cornea is different than the curvature in an opposite direction. We're born with it. It's part of our prescription in our glasses or contact lenses, and it is very, very much amenable to treatment with the laser.
Well, some people have such severe astigmatism that they can't wear contact lenses. Is that correct? Because they can't properly adhere because of the abnormal curve?
That's correct. Some of those patients, some of those people are candidates for refractive surgery, but we have to do specialized testing where we measure the amount of astigmatism. We actually take a map, a sort of a map of the shape of the astigmatism. That coupled with the thickness of the cornea. Again, the cornea is the clear covering of the eye. It has to be of sufficient thickness to be reshaped. If it's too thin, there's no room to reshape it. So the cornea, these are all technical aspects of a very careful preoperative evaluation that is mandatory for every patient that has refractive surgery.
The map is very cool. It's like a topographical map, so you can see the high points and low points of the cornea. I kind of think of astigmatism as most people, their eyes more shaped like a baseball, but with astigmatism, it's more shaped like a football. And so
Okay.
that's how the angles are different.
Now, are there people who are both nearsighted and farsighted? Can you be both?
No, but you can be nearsighted and also have difficulty seeing up close. That would be someone typically over the age of 40. I'm over the age of 40, and I am nearsighted for distance, but I can't see up close without glasses or contact lenses. So you're not really farsighted, you have what we call presbyopia, the condition of not focusing at near, and that can be combined with either nearsightedness or farsightedness.
Take us through a typical surgical procedure. The patient comes in, you've determined that they need this particular surgery. They come in that morning, and what happens?
The day of surgery, patient goes to the laser center. They receive a very mild sedative, so that because most people are really nervous, but we just
Is
give
it a
them
pill that you swallow?
Yes.
So it's no, you don't need an anesthesiologist.
No.
There's no propofol or any kind
no.
of
It's a mild Valium, a very small dose.
okay.
They come into the laser suite, an eye drop is placed in their eye, and that's the only pain, drug they're given. There's no IVs, no pills for pain, just an eye drop to freeze the eye. Then a delicate instrument is placed underneath the eyelid to open them so that there's no fear, no worry about blinking. Patients are always concerned, well, doc, what if I blink? And you're not able to blink because
So
we're
it's
holding
like
the
it
eye
holds
open.
it open.
It holds it open. The patient doesn't see the procedure happening. The eye is now held open, and we use two different lasers. The first laser is used to make a flap. The cornea, as we told you before, is the thin covering of the eye, and it's, let's say, 500 units, 500 microns thick. We'll make a flap that is 20%, 100 units thick. So if this is the cornea, we'll make a thin flap on the outside of the eye. It folds open like this, and then on the inside layer, we reshape the shape. The flap is put back down. There are no stitches, no glue, and it's like a human contact lens.
Wow, so you actually created it for them.
Yes.
We're going to come right back in 2 minutes, talk more about the surgery and then the post-surgical care. We'll be back in 2 minutes.
What's going on in your neighborhood?
They say it takes a village.
It's the simple things.
The things that are a testament to the old.
And the things that are a testament to the new.
Know what's going on in your community.
Check out our community channel on newradiomedia.com.
Advertising your business these days can be challenging. Traditional radio and TV ads are expensive and, frankly, a bit of a crapshoot. Not to mention, the audience for over-the-air material is shrinking as more and more of us demand to see and hear what we want, when we want. Advertising on New Radio Media is a solution. With our live streaming programs that are also available on demand, your message is always ready when your customers are ready to watch and listen, all for a fraction of what you'd likely have been paying for other ads. NewRadioMedia.com. Call Buzz Van Houten at 248-939-9999 for more information.
Low budget movie version.
60s TV version.
Early 2000s high school pseudo-adaptation that eventually grows into the geek we all know and love version here. I'm getting paid a lot of money to be here, so listen up. Watch the Geektainment channel on newradiomedia.com. It's geek approved. It's all about you, and that's the way we like it.
Where you're going.
What you do to stay fit.
What you're eating.
What you're thinking.
And how you're feeling. Join the conversation at newradiomedia.com's Lifestyles channel.
Stream the life you want to live.
Thanks for joining us again. We're going to continue telling you what the day in surgery is like. So we know that you take your Valium, you get your eye drop that freezes your eye. Now you're laying there comfortably and you've done your refractive work. And then what happens when you go and put that back?
Right. So we were talking about in LASIK how we create a human contact lens-like material where the flap is lifted, the laser energy treats underneath the flap, and again, we're outside the eye. We lay the flap down, just squirt some water and some medicine, some antibiotics on the surface. We remove the speculum, which was holding the eye open, and we go ahead and do the same procedure on the other eye. So both eyes
You can do
are
them
performed.
both the same day.
We typically do both on the same, assuming they need refractive surgery, we'll complete both eyes corrections in the same sitting, and typically this takes about 5 minutes per eye. So
That's
it's a
it?
very
So
brief
it's 10
procedure.
minutes?
Well, there's a lot of preparation to get to that
Right,
point,
but-
but once we're in the operating room, it's about a 5 to 10 minute procedure, and that's about it. Patient goes home. As they're going, they're not allowed to drive because they've received sedation, but typically patients have vision that's really good enough to drive almost immediately. When they get home, and their patients will tell me, oh, I can see the billboards now where they couldn't see them
Do
before.
you check the vision right afterwards?
I don't check the vision, but I do check the flap to make sure that it's in good position. I don't want them to leave the laser center if there's any issue with the flap. But when they go home, I tell them it's going to feel like there's a thread or a hair in your eye. We don't give them strong pain pills. You can take an aspirin or a Tylenol. Oftentimes that's not needed at all. They're given eye drops, antibiotics, anti-inflammatory drops. They have a little bit of a scratchy sensation, but what I tell them is eat or drink some comfort food and take a nap. Take an hour or two nap with their eyes closed, because it's really hard for anyone to keep their eyes closed for an hour or two unless you go to sleep.
Right.
So I say, go to sleep, take a nap. And when they wake up from their nap, it's amazing. Within a few hours of a nap, the scratchy sensation is pretty much gone. The vision is already clearer. And by the next day, when they come to our office for their one-day checkup, they drive their own car. So the visual recovery is great. Post-operative pain is really unusual. You know, it's very, if someone's going to have pain after this kind of an operation, something terribly wrong has happened. But in my experience, that really is not common at all.
Do they wear anything to protect their eyes for the first night?
Right, so, you know, when we laid that flap back down, we don't use any glue or any stitches, and just the action of the eyelid blinking over it acts like a human squeegee, smoothing the flap. But if we were to take a hand and rub the eye vigorously, or God forbid get hit with a ball or something, the flap could move. So for the first 4 or 5 days after the operation, we give them a clear sort of shield to cover their eye only when they're sleeping. During the day, they can wear sunglasses if they feel the light is, oftentimes they'll have a little bit of light sensitivity, and sunglasses are useful, but they don't have to wear patches, and they just use special medicine drops for the first week.
Are
And
they
then they're
like
done.
antibiotic drops to
Yes.
prevent an infection in
An
the eye?
antibiotic drop, an anti-inflammatory drop. But I'm glad you asked that, because there is a risk of infection after LASIK, but it's exceedingly rare. Patients will ask me, but I wear contact lenses, why should I have LASIK? There's a risk, many people don't realize this, there's a serious risk for infection with contact lenses.
Especially when people don't clean them properly or as often as they should, leave them in too long, get dust and things trapped
Well,
in
you
their
know,
eye.
it was very common. It's not common in our practice, but it was very common just a few years ago for people to wear extended wear contact lenses where they would put them in and leave them in for a month. And slowly we discovered that it's not really safe to do that, and so we backed off to a week without taking them out. We found that too is not safe, and so then we said, well, maybe wear them overnight. And it ends up, the scientific studies have shown that even 12 hours of sleeping in a contact lens can increase the risk of infection that can really lead to blindness. So the risk of infection from contact lens wear exceeds the risk of infection from LASIK.
Interesting. What about cataract surgery? I want to talk about that because so many people I know lately have been getting cataract surgery. And with that, they do one eye at a time. They don't do both eyes at the same time, usually.
Well,
What's your feeling on that?
In the United States, we only do one eye at a time, but that's only for insurance reasons. The insurance company insists on one eye at a time. They won't reimburse us if we do the second eye at the same setting. But in other countries, especially like in Canada, there are many surgeons that will operate on both cataracts at the same sitting, the same time. So I have no experience doing that because I've only practiced in the United States.
Why is it that they don't allow you to do both eyes at the same time if there's no harm in doing that?
Well, I assume they feel it's riskier, but there have been many studies to show that the risk is really not present. It's really a very convenient way of doing it, but for a variety of reasons, I don't even know the reasons why insurance companies don't permit it, but we can't do it in the United States.
Financially, it would make more sense for them to have it
I would
done
think so.
one eye.
Well, I mean, it would make more sense for the patient. It would be much more convenient
Of
for our
course,
patients.
why have to go in twice when you can get it done at one time, both eyes?
In any case, I'm really privileged to be able to perform cataract surgery, and I've seen the changes over the past 30 years in technology, and oftentimes I'll say to my nurse when I'm doing the surgery, I'll say, I know I have better skills after 30 years, and I know that is definitely part of why our results are so good, but it's not just me. I can't take all the credit. The technology has gotten so much more advanced that now, as a matter of routine, we can take someone who is actually blind and allow them to see well enough to drive a car the next day without glasses.
Now, is this a lot due to lasers as opposed to the tools you use?
I'm glad you asked that.
Well, I'm a strong proponent of laser cataract surgery. We can remove the cataract without the laser, and it's typically done with an ultrasonic machine. It's a miniature vacuum cleaner whose metal tip vibrates 50,000 times a second. So obviously you can't see that,
Right.
but it makes a buzzing sound, and that helps break up the hard cataract. 'Cause a cataract is not liquid, it's sort of a consistency of a boiled egg, but even firmer, like a hard-boiled egg. So we have to remove the hard, brittle lens, remove all of the lens material, and then place a new lens in its original place. And really, the lenses have gotten so good, and the surgery, the equipment has gotten so much better that, well, of course, my skills are good, but I can't take all the credit. Modern technology really has enabled our patients to have an amazing result most of the time. Now, it's an operation. There are risks. Every operation comes with a risk. But the chance, what I tell my patients, the chance of you losing vision from a cataract operation, that chance is less than your chance of being involved in a serious car accident
Yeah, I've never
on the way
heard
to
of
the office.
anybody that had cataract surgery and got their vision
Well, no.
worse.
Unfortunately, it does happen.
But I've never heard
But
of it.
no,
So,
we
and I'm
have
sure
seen
they're
it.
not your patients that
Well,
it happens to.
It's very, very unusual to happen. It can happen. And the important point, why I brought that up, is that we don't want to trivialize cataract surgery or any surgery. It's a real operation performed by humans. We can reduce the risk with many of our surgeries, no matter what surgery we're talking about. But with regard to eye surgery, I feel that I can reduce the risk of surgery by using a cataract laser. The laser will do certain delicate parts of the operation that I certainly can do by hand. I have skilled fingers that can do very nice things in the operating room by hand. But a laser guided by a computer is better than me.
Well, I know Dr. Berkowitz is a big fan of lasers, and some of your best work is done with lasers.
Yeah, so the majority of the work that I do is with lasers as far as surgery is concerned, and I put down the scalpel blade, but it's actually a different laser. There are several different lasers that are out there. So Dr. Novetsky uses a different laser that I have actually never touched.
Right.
I wouldn't even use that laser for my...
That's why you're such a good team. You clear up their vision so they see what they need done, and then they come to you, and you use your laser to perfect how they look on the outside. So it's not only how they look, but it's what they see that gets improved between the two of you.
Yeah, well, lasers are a great tool, and they're used by many, many different fields of medicine. It happens that ophthalmology was really one of the first fields to really popularize the use of lasers, but it's used in dentistry, it's used in abdominal surgery, it's used in many, many types of surgeries because we recognize through the advancement of technology that a laser is an excellent cutting tool. It cuts better than a knife, which is why Dr. Berkowitz uses it for his skin surgery, because he can do the same operation without a laser, but the laser cuts and smooths and treats skin in a way that allows faster healing, less bleeding, less bruising. And in my surgery, lasers are used to make incisions in a way that are much more precise than anything a human can do. So as a team, we use different lasers for different purposes, and it's a wonderful physician extender. It's not just the human that's doing the operation, but using a machine to extend our own skills.
Well, I know I learned a lot tonight, and I hope that a lot of people out there who are suffering from vision deficiencies, whether it be farsighted or nearsighted, may not have known about this. So I want to thank you so much for coming here, and I hope this partnership goes on for another 23 years. You seem to be more like best friends and brothers than just business partners.
We are.
So it's a wonderful relationship. Thank you so much, and we will be right back.
Hey, you guys, it's Raphael of the Teenage Mutant Ninja Turtles. Guess what? The only thing we can get down here in the sewer is Geektainment Weekly on New Radio Media. Turtle Power!
Detroit. It's the home of some of the world's most talented artists. It's where techno and Motown were born. It's a city where you can experience raw, untamed rock and roll. I'm Ben Rose, and I'm inviting you to join me weekday afternoons from 4 to 5 for the Motor City Juke Joint. I'll have interviews with musicians, info on what's going on around town, and a playlist curated by me just for you. It's all right here on NewRadioMedia.com.
Do you want to see things like this?
Did you just say you died?
Well, I mean, technically.
Or maybe even something like this.
We'll do nothing but destroy your corpses and burn them all for my dogs.
Your dogs are gone.
And sometimes, a little of this.
We need to have a talk.
I take my axe and I smash it.
No!
And check out Podquesters, the show where we tackle ghoulish goblins, fiendish foes, and dangerous drakes.
Oh, like the singer?
No, the dragon creature. Anyways, Podquesters, Fridays, only on NewRadioMedia.com.
Hi, I'm Art, and we're the crew at Tuffy Walled Lake. We've been in Walled Lake for 20 years, and through our knowledgeable staff and customer satisfaction, we've become quite the cornerstone in our community and to our discerning customers statewide. We know how important your vehicle is to you, and we take pride in our impeccable, affordable service, and we're trying to get you back on the road as quickly and safely as we possibly can. Please stop in and see why everybody comes from all over to get their cars serviced at 784 North Pontiac Trail in Walled Lake.
Doctor, my eyes have seen the year.
Welcome back. We have another special guest for you. We're still in the realm of eyes and vision, so we have the beautiful Loma.
Hi.
Welcome. We're happy to have you.
Thank you.
So you're the person that decides when a person gets the prescription for glasses, maybe they've never worn glasses before, and they have to decide what frame is good for me, what color frame is good for me. What is it, metal frames or you know, the frameless lens, those little round ones
Right.
without the wires. So take me through a typical examination for a first-time glasses user.
And the typical person is me, because I only trust Loma when I try on sunglasses, regular glasses. I go to Loma. She knows to perfection how to fit those frames.
Well, that's so important, because sometimes I know I'll go into a shop looking for sunglasses, try on 8 pairs, and unless I have a friend saying, how does this look or how does that look,
Right.
you can't really tell on yourself. You're not that objective. So tell me, what's the first thing you look for? Is it the shape of the face, the color hair?
Well, we first off educate the patient on the prescription, what kind of changes they've had, what they can benefit with this prescription, and then we decide on what they can actually use as far as the prescription. There's different lenses, there's different options that we can educate the patients, and then we go along with picking out a frame. And then frames are amazing because they can really give lifts for ladies, because we don't want jaw lines to kind of be more pronounced. We want more cheekbones, so we can do that with frames too, that you can some frames.
I have a million questions. Okay. So let's say you're a woman, you come in and you're fairly young and you have just a typical kind of oval face. Do you go by my face or my hair? Like if I have black hair, are you going to give me black frames to complement my hair? Or if I'm blonde, are you going to give me more tortoise shell? How does that work?
Blondes can totally do color, black, red, burgundy. They can totally eat up all that color because of the skin tone, but definitely the shape also. If they have higher cheekbones, we want to keep that and more enhance it.
Okay, so if I were going to come to you right now, pick me a pair that you think would be good for me. And I'm going to try it on. You can tell me what you think.
Something like that right there.
Okay.
Look at the bling on those.
I know, and they can, they're stylish. They can be,
Yeah,
there's a
they
lot of
match my
bling on the
nails.
sides.
Right, okay, so you would think that this would be a good look for me?
Absolutely. So it enhances on the top. It gives you a beautiful lift, so we see more cheekbones.
Okay.
And
like
less
that.
down here at the bottom.
Okay. What about something like that?
This would be a fantastic sunglass because it gives you a bigger lens. It's going to give you
Now,
a
is this
better
the aviator
protection.
look?
Yes.
Mm-hmm.
So what do you think of that?
Absolutely
I like it.
beautiful.
You like that?
Yes. We would totally
now, can
do
you
that.
do this as a regular eyeglass as well as sunglasses?
I would, I can. I wouldn't actually recommend it because it's actually going to pull down your face more when I look at you. I'm going to more.
If it was clear, you mean?
Yes.
Mm-hmm.
Okay. Great. Now, for a man, for example, what would you pick out for the doc? Which
Dr.
frames would look
Berkowitz,
good?
I kind of did something like this for him.
Let's see.
Very
how that-
similar. Yeah, and it has a magnetic clip on that's also polarized.
Oh, I think that looks very
nice.
distinguished. I like that.
I like the fact of the clip.
Right. I just
So is
put
it, it's
those-
a magnetic clip? So it just
Yes.
that's
It's
neat.
polarized too.
So when you say polarized, is that light sensitive? It takes down the sensitivity to lights?
It actually will cut down on all of the glare. So if you're out on the water, all that top surface glare is eliminated.
So if you're a fisherman, you can look down into the water and you can see the fish swimming by with polarized.
Gives you clarity.
Wow. Now, what about something like this, which is a very light color? Who would this look good on? 'Cause that's almost like the cat shape, isn't it?
Right. My
Like this was
ladies.
really popular in the 50s and 60s.
It's all coming back.
Is it?
It is.
See, this doesn't seem like it's me, though, does it?
No.
No.
Okay.
That's why she didn't pick it for you.
I know. I was just curious to see how that would look.
And
Now,
bigger.
Okay, so this is a different shape, and this is the darker color. Could I get away with that?
Different shape a little bit. That's
No,
more rounder, so it's pulling your face down again.
Yeah, so you're getting the no there. Okay, so
There's the tortoise too.
oh,
Now-
here's the tortoise. Now, naturally, this probably would be what I would go for, not knowing because of the tortoise. Does it work or it doesn't work?
Does not.
Does not.
Does
Maybe
not.
if we're a little smaller.
Yeah, a little
Yeah.
bit.
So it's too
Yeah.
big.
You have high
So-
cheekbones, and we want to
Accentuate that?
exactly.
So do you think the biggest problem is that do people pick out glasses that are too big for their face? They want those big old round glasses and they just get lost in the glasses?
Absolutely. We see it all day, and I'll be very honest with them, and I will tell them that I don't think it looks good. They're almost like they're swimming in their glasses.
See, that's what I see a lot, and they have that bug eye look, those
Exactly.
great big eyes. I think it's okay for sunglasses when they're a little
Mhm.
bigger,
For
more
sure.
Hollywood looking, but when you're looking through big glasses that are clear, it's bug eye looking. I don't think it's attractive.
So can these frames be used for somebody who has a bifocal as well?
Absolutely.
And what should the person who's wearing a bifocal, do they need to look for a different frame, or how does that work?
That's the one that's half and half, right? Where the lower half is for close vision and the top half. Is it hard to get used to looking from the top or the bottom, or does that become second nature?
It's pretty much natural. The technology now that they have with progressive lenses, for instance, they've expanded the areas of viewing so it's sharper and clearer and more natural. So a lot of my older patients that are not used to a line or a no-line bifocal are wearing the no-line progressive lenses.
So progressive meaning that it progressively gets stronger, so that usually you don't have that line of distinction.
Oh, but the lower
but
down,
as the lower
that
down,
you
the
look,
stronger,
it's stronger prescription. I have a question: pricing, because a lot of people wonder. Oh, let me see those. I didn't try on those Dick Tracy looking things. Or
these are actually a magnetic.
So that makes those sunglasses
very convenient.
Oh, gotcha.
If you don't want two pairs.
So we'll just show that to people so they can see how cool that is. You can wear it this way, or you can wear it this way. Price point. What does something like this cost if you want both the sunglass and the regular glass?
That ranges about $200.
Okay. What's the typical average price for a nice pair of glasses nowadays?
Loma can answer that better than I can.
They can average price points anywhere from $79 to $500.
What would be the $500 lens? Is that, which one would be the
Jimmy Choos.
This one?
Yes.
With the, I wish you could see the sides. They're all bedazzled and glittery.
So that's the same gentleman who makes the shoes?
Yes.
Mm-hmm.
Okay. So the Jimmy Choos, these would be closer to $500.
The $400 range.
Okay. But worth it if you like the look.
Absolutely.
It is a beautiful look.
If you want this look, then you're going to pay for this look. So the average is like $200 to $300 is a decent pair
Absolutely.
of glasses.
Yes.
Now, do you advocate that people have more than one pair with the same prescription in it, so that one might be a little dressier if they're going out in the evening, and one might be a little more casual for daytime?
I do some of that. I do more of your clear pair for every day in sunglasses, because we try to have our patients protect their eyes when they are outdoors, just like sunscreen on their skin.
What about transition lenses?
Transition have improved so much right now, where they're practically clear indoors, very slight tint, but when you go outside, they will turn very dark. There is one other one that's called the Transition Extra Active, which will actually turn about 30%, 40% behind the windshield.
Now, what about any of these? Are any of these the ones that when they go outside will get darker, or these are just regular
we would have
glasses?
we would have to actually order the lens with the transition.
So you can make any of these into a
Yes.
transition.
Oh, you can?
Yes.
You just pay extra and order that. How much
Correct.
does that add to the cost of a typical pair of glasses?
About $100.
Oh,
But
that's
a
not
lot
bad
of
at all.
insurances are now covering it too, where it's nothing out of pocket.
Oh, that's even better.
Yes.
Well, I would think, for me anyways, if I were to wear glasses on a regular basis, I would have several pair.
It's a fashion statement.
To just different looks, different times. But you brought up a point that I think is very important, and we've talked about this before. The importance of wearing sunglasses is like putting sunscreen on your body. Sunglasses do the same for the eyes, because they're sensitive to the sun rays.
And we
as
were
much.
talking about cataracts before, and
UV.
part of it is the breakdown, the oxygenation. And so by wearing sunglasses, you're protecting the lens within the eye itself, too.
So it's very important to have both. If you don't have the pair that you can convert with the cover that turns them, or the ones that automatically turn dark, then you need to keep two pair with you. Your sunglasses in your purse and your regular glasses in the
Right.
purse. How young is the youngest patient that you fit for glasses? Do you do a lot of children as well?
Not a whole lot of children. I have done about 2 years old. I've seen 3 years old, where they have special temples where they hook around their ears, so they're not dropping them or losing them
I would
as
think
much.
for younger children it'd be harder to keep track of them. They'd lose them more. But you do see smaller children, toddlers, who are wearing glasses.
Correct, because
Yes.
what ends up happening for them, they have something many times called esotropia, where the eye is turning in because of the prescription that they have. And so if the prescription is not corrected, then they can lose vision as they mature. So glasses at a child even like 1 year old at times, just to keep their eyes straight.
So they can be
So
corrective.
so if a family sees that their child's eyes are turning in or out, they need to be seen by an ophthalmologist.
Well, isn't there surgery for that as well?
There's
if they
surgery
have
as
that
well,
with
but-
those wandering eyes, or with one goes a different
But
direction.
many times it's due to a refractive error that they need glasses,
And that can
fix it without surgery.
That's interesting. Do you
Mhm.
advocate that children wear sunglasses as well when they're outdoors?
Definitely.
Absolutely.
Because I always tell my little grandchildren, put on sunglasses.
Yep.
You know, and they run around and they fall off and they lose them, and they're inexpensive enough that whenever you're at a drugstore, you can pick up another pair for them.
Right.
I think it's important to educate people to the variety that they have in eyeglasses. And some people have trouble with contact lens. They're unable to put them in, or they bother them all day. So they need to switch back and forth sometimes. They'll take their contacts out, put on their glasses. Is the prescription the same for a contact lens as it is for a pair of glasses?
It's not exactly the same. And so, just like we were talking about with refractive surgery, there's a fitting for it too. And so it's the prescription plus it's the shape of the eye as well. So you can't just take the glasses prescription and turn that into a contact lens prescription. There's a separate fitting for that.
Well, I think these are my favorites of the day.
Those are
I really
hot.
like these. Now, are these the Jimmy Choo
Yes.
also? So what would this pair of sunglasses set me back?
About $429.
About, that sounds
That's
exact.
about $429.
Okay, so it was-
I sell it a lot. It's
Okay,
one of my
so-
favorites. I wear it
No,
too.
but this is a great pair of sunglasses. I think it's great. I think this would look good on anybody. So I might have to, these might have to
Disappear?
Go home with you.
But anyways, I think we've learned a lot about glasses, because I don't think everybody realizes how much of a selection you do have. No two glasses are alike. They're different colors, different materials, different shapes, and I think all of that needs to be worked out with the person. Now, are you an optician?
Yes.
So an optician can help you pick out the right shape, the right color, the right price range, and work alongside with the eye doctor who gives you the prescription so that you get the lens you want and the look you want and the price you want.
Yes.
Thank you so much for educating us.
Oh, you're
you may
welcome.
take all this home with you except for these right here. I'm keeping these. We'll be back in 2 minutes to talk about celebrities and how glasses have changed their life.
And action. And millions of ducks. The two guys go to newradiomedia.com.
The Arts and Entertainment Channel on New Radio Media .com.
As a business owner, you're always looking to save money and cut costs where you can. And if you advertise on radio or television, you know it can get pretty pricey. If radio and TV aren't delivering like they promised, and you're looking for a more reasonably priced way to get your message to the masses, I've got an answer for you. New Radio Media. With live streaming and on-demand programming, your message can be seen throughout the day, and you can worry a little less about cutting those costs. For more information, go to newradiomedia.com or call Buzz Van Houten at 248-939-9999.
Hi, I'm Andy.
And I'm David.
Join us for fun and adventure on our new show, Podquesters, where we fight through imaginary battles and pray to the dice gods for good rolls.
Yes, it's an epic sweeping adventure. We try to fulfill our destinies without driving the Dungeon Master crazy.
I thought that was the point.
Anyways, check us out here on newradiomedia.com Fridays, Podquesters.
See you there.
Welcome back. We're going to look at some celebrities and see how they look in their glasses. And you decide if they pick the right shape, the right color, and if it looks perfect on them or whether we can do better. So who's first? Jennifer Aniston. What's your
I
thought?
think they're too low. I feel like she has really nice cheekbones, and when she's smiling, she's going to get her lens dirty.
Yeah,
So
it's much too big of a frame.
I think
too.
so.
It's making her look like an owl.
Yeah, and that top right there, and that
It's just too
middle,
low.
that's your focal
So
point.
should the top of your glass be even with your eyebrow, below your eyebrow, or above?
Everybody's different because
Okay.
everybody has higher
Different
eyebrows.
eyebrows. Okay. So we decided we
Yeah,
don't
we
like
don't
that.
like
on
that
her.
on her.
Okay,
No.
next.
Tina Fey.
Okay, so I think those look good on her.
I
Do
think
you?
they're beautiful because it gives her a beautiful lift. I can see her cheekbones. I can see her jawline. I think that enhances beautifully.
And I like the color. Everything about that looks
Mhm.
good for
It's
me.
amazing, yeah.
Do we all agree that works?
That works for her. Let's see who's next.
Okay, those.
I like those.
I think they're very.
They're trendy.
Very professorial. He looks like a professor or
Yeah.
an insurance salesman or something. I would expect someone in show business to maybe have something a little flashier, but it suits him. What do you think?
I think it works. It's not my favorite pair.
Right, it's not my
But-
favorite pair, but he pulls it off.
I think he
But he's
thinks that
dressed
he's
down.
Yeah, I think he thinks he's hiding, and nobody will recognize him in that pair.
Well, maybe, but I think he could do better. He better come and see you. Okay.
Let's see who's next.
Oh,
No.
Johnny Depp.
First of all, they're ill-fitting.
Yes.
Yeah, they're,
No,
they're,
I don't
they're
like
cockeyed.
that.
They're
They cover the top of his eye almost.
The
and-
one side,
on
they're
the- yeah, so I don't know if they obscure his vision
and
or whether he's
they're
just
too small.
very small.
I don't know
I
what,
don't
what
like
look
the
he's
color.
going for.
I don't know either. Is that his pirate look or
I
is
think
that
so.
his? I don't know, but yeah, I'm not a fan of those.
It doesn't fit his grunge look either. There.
I see too much of underneath the eye and nothing above the eye.
Right.
They look too low on his face.
It's
Maybe he's got a bifocal in it and doesn't want people to know, so he's looking through that
That
shiny.
could be. They could be as thick as Coke bottles for all we know. All right, next. Oh, Eva Longoria. I like those.
I like
on
those.
her.
Very nice.
What do you think?
So it's a nice frame. It looks almost like a two-tone frame, right?
It
looks like it
is.
has white on the outside, and she's at an angle, and I can tell you she's nearsighted by looking at the glasses and how it changes her eye. And some of the other glasses we were looking at, I think they were probably Plano lenses.
Plano, right.
Meaning basically no prescription, but there is a prescription here.
I like those on her.
The only thing I can see is that it makes more of her face look into a triangle, and her
So it's adding
chin.
too much width
Yeah,
at the
her
top
chin is
for
like
balance.
her focal point to me.
Okay.
So Steve Carell.
Steve Carell. Again, he has the ones that are like low down under his eyebrow, but then they come way down on
Right.
his cheeks. Don't they come low?
But the plastic frame on the top is way thicker than the bottom also, so it kind of gives them that unibrow look.
What are you thinking? You're like studying it. I'm
Yeah,
trying
I'm
to
looking
read
at
you.
I don't love it. It's not terrible,
Right.
but to me, not that there's anything wrong with it. It looks to me like he went to Kmart to get this pair of glasses fit.
He could do better.
Yeah.
Well, there's no more Kmart, is there?
Okay, now I don't feel so bad.
Target. He went to Target or Walmart.
Walmart.
Okay. Yeah, they're not bad, but they're not sexy.
No,
you know,
not
they're
at
just
all.
not sexy looking.
So what is in now?
Yes, tell us what's in sunglasses.
Sunglasses, what you are wearing right now, the aviators, plastic, bigger, better protection, of course. But the aviators are real hot right now.
So
and also, excuse me, but you mentioned the lens that are dark outside, but then when you go indoors, they get clear. Because sometimes when I'm wearing sunglasses and then I go inside, I take them off when I'm shopping or something
Right.
because I don't want it to be that dark. So there's something to be said for those that change from outside to inside.
And those are your everyday glasses. That's why it gives you that conveniency of having the 2 pairs, and you can leave your sunglasses in the car and still be able to wear your everyday glasses. They are going to change when you do go outside, even on a cloudy day, so it's still going to give you that same protection.
And they've gotten better because they used to be slow changing, so now even if you're driving and you go into a tunnel, they change fairly fast.
Yes.
Because before, if they didn't change fast enough, you would be, should I take off my glasses?
Yes.
Should I pick another pair of glasses? Because they didn't change fast enough and things would be too dark. But
another thing I think is important to mention to people is that you should always keep your glasses, sunglasses or regular glasses, in a nice case.
Absolutely.
So they don't get scratched. People just throw them in their purse and then they wonder why they're so scratchy. And then you should also have a nice cloth to keep them clean. I see people all the time, and I look at their glasses or their sunglasses, and there's finger marks on them, and they're all
people
dusty.
use paper towels too, and not realizing that can scratch the lenses and take coatings off.
Is there anything on the market that repairs scratches in a lens?
Unfortunately not.
So
Nothing
once
out
they're
there.
Scratched, they're scratched.
Yes, we can't do anything about it. It's like taking prescription or sandpapering a wall, for instance. It's taking a prescription off the lens itself.
Well, I know I've learned a lot, and I gained something in the process. So I hope you like these glasses as much as I do. They're Jimmy Choo's, so just the title alone makes me feel very classy. Loma, thank you so much for all your expertise. It's always a pleasure to have Dr. Berkowitz as guests because they're always as equally beautiful, intelligent, and skilled and knowledgeable as he is. So we thank you very much, and we will be back next week with more great information on cosmetic surgery.